to fix our staffing, to provide good patient care, and to make sure that every family who relies on an employee that works at Butler Hospital to pay for your housing, to pay for your groceries, is going to make living wages. And that is why here today we are taking a strike vote right over there. So if you have not taken your vote yet, please make sure to step out of line and do so that we can have, as the bargaining committee, all of the power that you guys have standing together to be able to reach a fair contract as soon as possible.
Hey, what do we say?
1199 is here to stay!
Hey, what do we say?
1199 is here to stay!
Guys, come on, slide down a little bit so you can hear everybody. Come on. Let's not be strangers real quick.
Everybody move up!
So as everybody knows, this hospital's wage proposals do not even get to a starting wage for most of our members, so that they would still qualify for food stamps in the state of Rhode Island. That's wrong. Care New England, you need to do better. Our members for over a decade at this hospital have sacrificed to make sure Care New England successful. Isn't that right, guys? When times were tough, we worked through those times and made sure this hospital survived, didn't we? Yes! Now, after this hospital and the rest of Care New England's making record profits, we deserve to be taken care of. Yes! It is not acceptable to take our retirement system and our health care and use that money towards our wages. No! We're not going backwards, we're going forwards. But I want to read something to you that came from one of our other 1199 siblings in Care New England. A member who used the Butler Hospital services that saves lives every day. On October 7th in 2008, my husband was admitted to Butler for suicidal thoughts and a major nervous breakdown. We went to Butler Hospital in an ambulance instead of the planned limousine ride to take us to the airport for a birthday celebration in Paris. Instead, we celebrated with the staff at Butler Hospital and with my family on the locked unit. He was in that unit for 8 days. Not only I've never forgotten those dark days in my family's lives, but I am very grateful and fortunate and appreciative of the group of angels who took care of him, who brought him back to his normal, stable mental health. The work they do is priceless, and as a family member of an ex-patient, we owe his life to Butler staff. I know if it wasn't for them and the care he got, he would not be here today. That is like so many thousands of Rhode Islanders that deserve a Butler hospital that has the ability to continue that care into the future. Am I right, guys? Yes! We aren't just out here to make sure we can survive at home. We're out here to make sure our patients can survive. Because without Butler Hospital and our dedicated members who spent their lives caring for them, this entire state's mental health and behavioral health system falls apart, doesn't it? Yes! We need better. And both the management of this hospital and Care New England need to do better for workers, don't they? Yes! When you do better for healthcare workers, you do better for the patients. Yes! Like the story I just read from one of our own 1199 siblings. Every single Butler member does their work with integrity. Every single Butler member sacrifices a little part of who you are when you come in the door of this hospital. Isn't that right?
Yes!
And I'll tell you this, that's never for sale. They can't even afford what that would cost them to put that into a contract. Because that's a piece of who we are as people. But I'll tell you this, if this hospital doesn't show up on April 29th with a real proposal to lift our members out of poverty, to stop the workplace violence due to low staffing, then we will authorize a strike if necessary to get those things. Am I right? No one wants to strike. But our system is broken. This hospital cannot continue to function this way. The reports I heard from delegates for the last 2 weeks of being over census by dozens and dozens of patients, the lack of staff, the dangerous conditions, it has to stop now. Right?
Yes!
When the boss says no, we say yes. When the boss says no,
We say yes!
when the boss says no,
We say yes!
all right, let's keep picketing and let's make sure everyone gets out here today. Hey, what do we say?
1199 is here to stay!
Hey, what do we say?
1199 is here to stay!
No justice,
No peace!
no conflict,
No peace!
no waiting,
No peace!
no retirement,
No peace!
no health care.
No peace!
Hey, what do we say?
1199 is here to stay!
Hey, what do we say?
1199 is here to stay!
Were they driving away? Oh, they were going to drive by. Oh,
Yeah.